Good morning, everyone. Master Shalini Monty, Nursing India of Indus Nursing College. Today, I present the topic is strabismus. Strabismus occurs when both eyes do not look at the same place at the same time. The eyes are unable to align properly under normally conditions. स्टैबिमस में जो हमारी आइज होती है वो एक ही टाइम में बोथ साइड एक साइड नहीं देख पाती है, अंडर नॉर्मली कंडीशन रहती है. आई मेनली टर्न इन इन आउट अप और डाउन. ये सिर्फ अप और डाउन होती है. कैन बी प्रेजेंट इन द वन और बोथ साइड. ये सिर्फ एक तरफ देख पाती है. ऑफ्टन रेफर टू अस क्रॉस्ड आइज, कॉक आई, विक आई, वॉल्ड आई, wandering eye and or turn eye. Squint. It is a group of clinical conditions characterized by misalignment of the visual axis of the two eyes. Causes of a strabismus: first, result of the lack coordination between the muscles of the eye responsible muscle of the eye responsible for eye movement, problem with the nerves that transmit information to the eye muscles, problem with the control center in the brain that direct eye movement. The lack of coordination prevents proper binocular vision and keep both eyes from gazing at the same point. In adult, can be caused by stroke, thyroid problem, brain injury, or other trauma which disrupts the ability of the eye muscle to work properly. Risk factor: family history. If relatives have strabismus, a person is more likely to develop it. Refractive errors: extreme farsightedness, hypertropia can develop strabismus due to the amount of eye focusing necessary to keep vision clear. Medical condition: people with Down syndrome or cerebral palsy and people who have suffered a stroke or head injury are at higher risk for developing strabismus. When does it occur? Congenital developing during infancy. 50% of children with strabismus are born with it. Acute developing in adulthood can also develop as a result of lack treatment during childhood. What it's not. Strabismus is not the same as amblyopia. Amblyopia is called lysitis. It and is a condition where vision does not develop normally during childhood. Child may have one weak eye with poor vision and one strong eye with normal vision. Amblyopia does occur commonly with strabismus but is a vision problem where strabismus is a muscle problem. Development of infant. A newborn eye will typically move independently and even drift outward. It is not normally for an infant eye to close consistently by 3 to 4 months old. An infant should be able to focus on objective and eye should be straight with no turning. 30 to 50% of children with strabismus develop secondary vision loss. Amblyopia. Onset of strabismus is most common in children at 18 months to 16 years old. If a parent notices their child eye moving inward or outward, the eye seems to be crossed, or the child is not focusing on object, they should seek medical attention. Development in adults mostly like to develop as a result of injury or disease. Adults will most likely experience double vision, eye fatigue, overlapped or blurred image, a pulling sensation around the eye, difficulty with reading, and or a loss of depth perception. If loss of vision occurring, it is typically due to exotropia, eye turn outward, rather than amblyopia because vision is already developed in the adult brain and the adult brain will not compensate for deviation to the way and child brain will. Diagnosis: a comprehensive eye exam is necessary. We focus on the following. A comprehensive history is necessary to assess symptoms, health problem and medications. Acuity, visually acuity measurements are taken to assess extent to which vision is affected. Friction conducted to determine the lens power necessary to compensate for any refractive error. Alignment and focusing assess how well where your eye focus, move and work together. Eye health exam assessing the structure of the eye, internal and external, to rule out possible disease. Classification, flow chart of classification. Apparent sequence. Apparent squint, the presence of epithanus and high error of refraction stimulate squint, but in fact there is no squint. Latent squint, it is a clinical condition which is there is a tendency of misalignment of the visual axis which is corrected by the functional capacity. Etiology, increased requirement for accommodation and convergence. The result is esophagia. Decreased requirement for accommodation and convergence. Result is exophoria. Occupation requiring too much close work. General poor health, fatigue, and advancing age. Symptoms: eye strain and headache, prolonged work, blurring of print and overlapping of word or lines while reading. Diplopia after close work for prolonged period, intermediate squint or in the evening on reading or writing for an hour or two, crowding of words. Symptom of defective postural sensation. Diagnosis: patient can history regarding chief complaint, onset and duration, previous treatment and family history. Visual actually on macular affliction pattern is notice. Cyloplytic refraction and fundus examination, ocular movement and head posterior, measurement of convergence and combination. Assessment of binocular vision, cover uncover test, Maddox raw test, Maddox wing test, prism vagrant stance. Treatment: optical correction of the underlying refractive error, ortho, orthopedic ortho-optic exercise for improving convergence insufficiency or divergence weakness, surgical correction of the effective muscles, general improvement of health and nutrition, proper position, distance, and illumination while during doing near work and suitable break in between. Manifest squint, dilatation of the eyes, wherein the dimension remain the same in the direction of gaze. Types: concomitant non-paratic squint, inconcomitant paratic squint. Concomitant squint. It is a type of squint characterized by normal extracellular movement and constant degree of squint in the all direction of gaze. Types: esotropia, exotropia, hypertropia. Esotropia, convergent strabismus with eye divided nasally type. A combinative esotropia is due to the increased convergence associated with the accommodation reflux. Non-accommodative esotropia including congenital or infantile esotropia and occurring esotropia. Secondary esotropia include sensory deprivation esotropia and consecutive or surgical overcorrection related esotropia. आप देख सकते हैं esotropia में इस टाइप की आइज हो जाती हैं. The left eye is turned inwards. Note that the light reflection in the eye is not symmetric. Exotropia, divergent strabismus with eye divided outward temporally is called exotropia. It can be infantile exotropia, primary exotropia, and secondary exotropia. एक्सोट्रोपिया में इस टाइप की आइज हो जाती है. The right eye is turned outward. Again, not the light reflection in the eye is not symmetrical. Hypertropia. It is characterized by vertical misalignment of eye with upward deviation of squint eye. The common cases are trochlear nervoplasty, thyroid eye disease, Brown syndrome. Hypertropia. The right eye is turned upward, light refraction not symmetrical. Hypertropia. It is characterized by vertical misalignment of the eye with downward dimension of the squint eye. Hypertropia. Hypertropia. The right eye is turned downward, light reflection in eye is not symmetric. This type of eyes फर्स्ट में देखते हैं एसोट्रोपिया एंड एक्सोट्रोपिया, हाइपोट्रोपिया एंड हाइपोट्रोपिया. Etiology: sensory problem, reflective error, cataract, corneal opacity. Motor problem, abnormalities of extracellular ocular muscles, accommodation and convergence. Center problem, defective fusion, abnormal in the cortical control of extraocular movement. Inconvenient squint. It is characterized by limited or restricted extraocular movement and varying degree of squint in different direction of gaze. Paralytic and restrictive squint. Paralytic squint. It is characterized by limited extraocular movement in the direction of action of the paralyzed muscles and varying degree of squint in different direction of gaze. Etiology. It is caused by paralysis of the extraocular muscle due to second neurogenic cause. Are congenital anomalies of the nerves supplying the extraocular muscles, inflammatory disease affecting the nerves, brain tumor, cerebrovascular accident, thrombosis, or aneurysm. Myogenic cause, congenital anomalies of the extraocular muscle, traumatic causes, neuromuscular causes, disease affecting the neuromuscular junction. Clinical features: diplopia, vertigo, nausea and vomiting, false projection of the object, limitation of the ocular movement in the direction of action of the paralyzed muscles, compensatory head posture to neutralize the diplopia. Clinical types: oculomotor nerval trochlear nerval absent nerval total ophthalmoplegia, internal ophthalmopia, intranuclear ophthalmopia. Diagnosis: CT and MRI, diplopia charting, Hess screening test, Ward test, force duct test. Treatment: treating the underlying cause, treatment of diplopia by temporary occlusion of the affected eye or correction by optical surgeon, correction, resection, muscle surgeries, injection of botulinum toxin to cause chemodegeneration. Restrictive squint. It is characterized by restriction of the extraocular movement with small deviation in the primary position of gaze. Etiology: usually caused by the fibrosis of the extraocular muscles or by restriction of the movement of the extraocular muscles. Extraocular. The common clinical syndromes associated restrictive squint include Brown syndrome, strabismus pixels, Duane retention syndrome. Diagnosis: assessment of visual acuity of refractive error, corneal reflex test, cover test, prism bar cover test, Maddox lower test, Maddox wing test, assessment of binocular vision. Treatment: optical correction of underlying refractive error, optic exercise, occlusion therapy in case of amblyopia, surgical management. Resection by making the muscles slacking by shifting the insertion of the muscles posteriorly towards its origin. Resection it is done by making the muscle taut by sorting the muscles. For Etiology, resection of medial rectus and dissection of lateral rectus of the eye with squint. Resection of medial squints of both the eye for exotropia. Resection of lateral rectus and dissection of medial rectus of the eye with squint. Resection of lateral rectus of both the eyes. Treatment. There is no cure for strabismus. With treatment, the effective for strabismus may be corrected. The goal of treatment is to help the patient achieve as close to normal binocular vision as possible in very direction of course and at all distance. Treatment. Eye patch. The stronger eye is patched to force the brain to interpret images for the strabismic eye. Eye patches will not change the angle of the strabismus. Typically, eye patches is used only if amblyopia is present. Treatment. Eyeglasses or contacts. Eyeglasses or contacts are used to improve the positioning of the eye by modifying the patient direction to focus. Eyeglasses and contacts can also redirecting the line of light, which can help strengthen the eye. Treatment. Prisms are used to modifying the way lighting the images hit the eye. The lenses provide comfort and can help prevent double vision from developing. Treatment. Vision therapy, a non-surgical method of therapy that treats the eye and the brain. An optometrist will oversee the therapy, which is designed to strengthen or develop visual skill. The optometrist may also use eyeglasses, prism, eye patches, and computerized medical device during the therapy. Treatment. Eye surgery. Surgery may be necessary is an attempt to align the eye by modifying one or more muscle in the eye. During surgery, the muscle position will be changed or the length of the muscle will be changed. Surgery may follow a period of eye patching, and then eyeglasses may be used after surgery to help treat strabismus. Treatment. The best method, the alternative from treatment that uses natural remedies to correct vision problem, such as relaxation, exercise, game, and other activities. The BET method claimed to improve or restore vision through the elimination of mental strain. This is a very this is a very controversial method in the medical field. Treatment: Botox therapy, used as an alternative to eye muscle surgery. The idea is that the drug will temporarily relax the eye muscles, which will allow the opposite eye to tight, tighten and strengthen. The effective are short term, about 3 weeks. Eye muscle exercises and eyeglasses may also be used to help strengthen of the eye. Thank you.